Hello everybody and welcome to the Thursday edition of Video Clips, and I'm going to continue with this fascinating series on catastrophic care. But before I start, just a quick announcement. Remember, summer semester starts in less than a month at the Wellness Forum Institute. So if you're going to take the Diet and Lifestyle program with teachers like Dr. McDougall and Dr. Esselstyn and Dr. Barnard and Dr. Goldhammer, and also programs on vaccines and musculoskeletal disorders and mental health issues, it's time to register. And we also have a full repertoire of classes for those of you who are working toward earning the Nutrition Educator Diploma as well. So if you're interested in that, get a hold of us right away. It's time to get registered. All right, so back to catastrophic care, and I'm just going to pick up where I left off. And this is another situation about island, the healthcare on the island versus the mainland. When you think about it, technology makes everything that we do cheaper and better over time. Computers cost less and they do more. Cell phones cost less, they do more. Not in healthcare. MRI technology is 20 years old. It still costs just as much as it did, actually more than it did 20 years ago. Now, when we look at segments of healthcare that take place over here on the mainland, like LASIK surgery, that's an out-of-pocket expense for people. The costs have gone down by 90% since the procedure was introduced, and it actually is much safer than it was when it was first introduced. But that's what happens when we let market forces take over rather than island speak, where there's no cost for anything, we just pay whatever it is. And we pay for it whether it's any good or not. Now, in terms of profits, a lot of people think that the problem is insurance companies make big profits, and that's what messes this all up. But that's really not the case. And actually, profit serves a social function. It's to send signals to the marketplace to regulate supply, set prices, and improve service. So when there is not a profit motive, when we take away market forces, services get worse and prices go up. Let's look at a couple of things that affect the cost of healthcare that have nothing to do with insurance company profits. Avastin costs $88,000 for treatment, and it prolongs life for breast cancer patients for a month. However, it destroys quality of life for many of the women who take the drug, and some women who take it would have lived longer anyway. So is it worth it? Well, it's hard to justify, but Goldhill responds much in the same way that I respond to these issues, which is to say that we should have informed consent discussions with patients. Let them have all of the information about the risks and benefits, and then let them decide what they want to do, instead of assuming that the surrogates know best. And by the way, the FDA withdrew its approval to offer Avastin to breast cancer patients, but Medicare quickly responded by saying that they would continue to pay for it anyway. So that really doesn't lend itself to a profit motive as much as market forces thinking everything should be offered and no concept of the risks and benefits of this particular drug. Pricing on the island. You know, Dodd-Frank was passed supposedly because it would now be illegal for people to sign mortgages that they didn't really understand. But the Affordable Care Act, according to an advocate and expert on the topic, Richard Kirsch, allows just this to happen. On a radio show, he stated that the goal of the Affordable Care Act was to allow patients to get care without any consideration for payment or cost. But the payments are ultimately made in the form of higher premiums and higher taxes, which means we are all paying for this, and we should have the right to understand the cost. So we went through a great amount of effort to pass laws, and I think some of them are of dubious values, to make sure that people can't sign a mortgage without understanding what it costs, but we engage in health care without an understanding of the cost every single day. Expensive and unnecessary health care isn't affordable, no matter who's paying for it. If the profits of insurance companies, the 10 biggest drug companies, and all American companies were pooled together and confiscated, it would only cover the costs of health care for 7 months. So profit is not our problem. Who pays for health insurance? Let's take a look at that for a minute, because that does bear on it. Most people think their companies do, but the higher the insurance costs are, the less companies can afford to give directly to their employees. And I won't go through the whole complicated computation here. You can read the book on your own, but Goldhill uses the example of a person who has a $10,000 appendectomy who is so grateful that he has insurance. In this case, his employer's been paying $15,000 a year for 10 years of employment. That $150,000 would pay for the surgery many times over. And I think in his book TV lecture, if I remember right, he said this guy could have every member of the family have their appendix taken out and he'd still have money to spare. So this is the illusion of protection and the illusion of financial gain. And most people are paying far more for their health care coverage than they know. People pay a portion of their health insurance costs almost all the time. They pay Medicare taxes and they pay state and federal income taxes, a percentage of which funds health care. This means that a person making $35,000 a year actually contributes $10,050 to health care. And if that person just gets average raises and healthcare costs go up only 2% a year, fat chance of that happening, right? Healthcare costs will consume half of their earnings by the time they retire. We're all paying far more than we realize for healthcare, and even employer-sponsored plans are rarely free to the individual. Well, they're never free because, again, more spent on that, less money to pay employees. The government does a terrible job of controlling costs. They're supposed to be the good guys because they're controlling costs and they don't have a profit motive. When Medicare and Medicaid were enacted, the cost was estimated to be $12 billion annually by 1990, and spending hit that threshold 16 years early. Now, if healthcare during all that time had just grown at the same rate as the economy had, the average American would have had $4,000 more to spend this year. I know that sounds really good to me, and it probably does to you. The disconnect that causes the problems is that patients aren't the consumer. Instead, the surrogates are. That's why an MRI costs $300 if you purchase it yourself and $1,500 if the surrogates pay for it. And I recently heard about this from a friend of mine who wanted to get an MRI for his wife and was first told that he couldn't have it without a doctor's orders. Then he was told it would cost $1,500, $1,600. After they got over the shock of the consumer actually paying for it, the cost came down to around $300. Now, that's life on the island. On the mainland, what happens if you overcharge is consumers punish companies that charge too much or offer poor services. And Goldhill points out, have you ever noticed how many television ads and billboards and newspaper ads advertise that they're offering something cheaper? Our couches are cheaper, big lots, we sell the goods cheaper, DSW, discount shoes. You sure don't see that for healthcare. And the reason is because on the island, providers don't do better by offering cheaper services or better services. Well, the argument for insurance, in spite of all these problems, is that people need it more at some times than others, but other services are like this too. Think about it. People don't purchase cars and appliances or houses every year. We use a variety of mechanisms to purchase these other things, none of which applies to healthcare. And he offers, and I won't cover it today, but when I get to the end of the book, Goldhill offers some excellent suggestions on how we can take the way that we do everything else in this country from a consumer perspective and apply it to healthcare. Come in from the island, back to the mainland, and get this ship righted. So anyway, I'll stop there for now. It's a natural stopping place. That's all for this week. Have a great one. Pass this on to anybody you think should hear it, and I will speak with you again next week.